Generate a video in which a veterinarian doctor says, calf diarrhea, also known as neonatal calf diarrhea (NCD), is a major cause of illness and death in young calves, particularly in the first few weeks of life. Here are some key points. Well, causes. Infectious agents. Common causes include bacteria, e.g. E. coli, salmonella, viruses, e.g. rotavirus, coronavirus, and protozoa, e.g. Cryptosporidium. 2. Management factors. Poor hygiene, inadequate colostrum intake, and stress can contribute to the development of diarrhea. Symptoms. Frequent watery stools, dehydration, lethargy, loss of appetite. Treatment. 1. Fluid therapy, oral or intravenous fluids to manage dehydration. 2. Antimicrobials may be used in cases of bacterial infections. 3. Supportive care, providing a clean environment, ensuring adequate nutrition, and monitoring for complications. Prevention. 1. Good hygiene practices, regular cleaning and disinfection of calf housing. 2. Proper colostrum management, ensuring calves receive adequate colostrum shortly after birth. 3. Vaccination, vaccinating dams or calves against specific pathogens. Effective management and prevention strategies are crucial in reducing the incidence and impact of calf diarrhea on farms.